This podcast series is made possible thanks to the generous support of the Patient Care Foundation. The Patient Care Foundation supports medical students in need through scholarships. Each year, the Patient Care Foundation changes lives by giving deserving medical students facing incredible odds funds to continue their education, resources as they deal with food, housing and transportation insecurities, or other challenges in the wake of COVID-19. Thanks to Dr. Troy Elander, chairman of the Patient Care Foundation, and Elizabeth Kurohara, board member, for their support. To learn how you can make a difference for a young medical student, visit ladocs.org, click Advocacy, and click Patient Care Foundation. Welcome to this edition of Clear as Mud, the podcast dedicated to bringing clarity to medicine. I'm your host for this episode, Gustavo Friedrichsen. So why the name Clear as Mud? We didn't want this podcast to be like many other medically related podcasts. When we asked physicians to describe what medicine can be like for them as well as their patients, the need for clarity just kept resonating. Our purpose is to provide you a 10-minute tool that you can use featuring great guests, relevant topics, inspired conversations, and clear takeaways. The pandemic has destroyed lives and livelihoods. We wanted to hear from physicians who have faced tremendous adversity and hear their views as doctors, employers, business owners, parents, partners, and caregivers. Joining us today is Dr. Cesar Chavarria, who owns a pediatric pulmonary practice in Tarzana, California. Dr. Chavarria has more than 30 years of experience in treating pediatric respiratory conditions. He attended undergraduate school at Madrid College and medical school at the National Autonomous University of Mexico, both in Mexico City. He completed his pediatric internship at the University of Colorado Health Sciences Center in Denver, Colorado, and his pediatric residency at the University of California, Irvine College of Medicine, Long Beach Memorial Medical Center. Dr. Chavarria is fellowship trained in pediatric critical care and pediatric pulmonology. Dr. Chavarria, welcome to the Clear as Mud podcast.
Thank you very much. Thank you for having me.
Can you briefly share what the practice of medicine for you was like before March of this year?
Well, we were happy and we did not know it. It was stressful. It was busy. There were a lot of challenges. Reimbursement was an issue. It was rewarding, but then everything changed dramatically.
So walk the listeners through some of those stages that you talk about in terms of the changes, the impact, and the things that you went through from a practice perspective as well as a personal perspective.
Yes, I have been back and forth through a lot of different stages emotionally. I have had to reconfigure the way I see patients, the way I communicate with patients. I have had to try to continue to provide care while going through some anxiety and fear and agony. And a lot of changes have occurred in my practice. I do mainly telemedicine now.
Tell me or share with the audience too what the telemedicine transformation has been like for you. What did you have to do? Where did you start? And where have you finished with that journey?
I had to start very quickly because I was worried about cash flow. I was worried about having to see patients. I certainly did not want to get sick. So I had to do it very quickly with whatever platform was available technologically. I really was not properly set up. So I had to think about where my camera was pointing. I had to think about if my microphone was working. I had to think about how to send the link to the family to communicate. So I had to really juggle a lot of things very quickly under very stressful circumstances.
Let's take a step back for a moment. When we had our conversation, you talked about the emotional toll the pandemic has had on you. And the variety of stages that you had to go through personally to deal with pandemic, deal with economic impacts on your practice, deal with all the things you had to learn on the fly relative to technology. But let's talk about the emotional toll, if you will. Could you share that with the audience?
Yes, I still go through a lot of different stages of shock and denial and anger, and sometimes I just want to give up. Sometimes I want to retire. I read someplace that 11% of adults have considered suicide during this pandemic. I briefly thought about it. I don't think I really thought about it very as a serious possibility, fortunately. But a lot of stages of emotional anguish, anger, frustration, fear, depression, you name it. I've been through them. It has been helpful to find friends like you. Sometimes in the middle of a crisis, you connect with somebody who's willing to lend you a hand with whatever it may be, personal protective equipment, companies, ideas, just friendship, and just your personal story that you told me. Really, you connect as a human, and that helps you hold on to your life raft. So thank you.
It's an honor on my side too, Dr. Chavarria. What advice would you give to a struggling physician who's in private practice right now, who has not transitioned to telemedicine or is thinking about closing his or her practice? Any advice, any lessons learned through the last 7 or 8 months that you could pass on to a colleague?
Yes, well, it has been wonderful to have help from LACMA, help from the payroll protection program. So keep listening for leads for who can help you. And then there are certain glimmers of light in that a lot of the telemedicine is now reimbursable. So keep an open mind, try to be open to ideas and try to adapt, and your patients will understand. The only good thing about this is that we're all in it together. Our patients understand it. It's not like you are going through a suffering all alone and nobody understands you. Everybody understands that we have to adapt and we have to make it work somehow.
Dr. Chavarria, I appreciate you. We appreciate you. I'm sure your patients appreciate you. So on behalf of our 7,000 members, our board, our executive committee, and all of our affiliates and supporters, I just want to thank you for your time. We want to thank you for your contribution you've made to medicine and the over 3 decades of delivering great care to your patients and the community. Thank you for taking your time on a busy Thursday to be with us today. We wish you nothing but the best, and thank you for being our first guest on Clear as Mud, because the mission of this podcast is, we call it bringing clarity to medicine, and hopefully through these conversations we will do that. So thank you again for being part of this process.
Thank you for having me.
Thanks, Dr. Chavarria, for joining us for this inaugural episode of Clear as Mud. We hope we've shed some light on how COVID has impacted physicians and shared resources for members going forward. We want to hear from you. Ultimately, the show will evolve as medicine does every day. What topics should we cover? Who would be ideal guests? To learn more, download expanded commentary or tap into resources to help you thrive now and in the future by visiting ladocs.org. That's ladocs.org. Many thanks to our sponsor, the Patient Care Foundation, for their generosity, and our production team of Gabe, Mike, and Dennis. Thanks for listening to Clear as Mud. Be safe.